On average, I see about 13 to 20 patients a day, depending on how the day is booked and how it's scheduled. I usually get up pretty early, start going through the patients. I get to work at least a couple hours before clinic starts. I look through everybody, start to pre-write my notes, and so what I can do is look through all their problems and foresee any issues we're going to have in clinic. So Dr. Evans sent you over?
Yes.
Okay. I see all types of patients, all ages. I see people at the beginning of their journey in heart disease to try to prevent anything from happening, and I see people who've had 16 stents, 2 surgeries, and my goal is to keep them as happy and healthy as long as I can. All right. So let's talk a little bit about calcium scores and kind of what they are and why they're useful. I really try to focus on the patient. I think they're the boss, and my job is to educate them and make sure they understand the risks and the benefits of anything that we do for them. I want to do as few procedures as possible on these patients. I want them to be healthy with minimal medicines, with hopefully diet and exercise doing the majority of the work for them. My concern is now with the hip replacement that you're not going to do as much running as you used to or not as much
I haven't run
exercise.
for 3 years because of that.
Cardiology is a very clinically based practice, and that's one of the things I like to focus on. I'm not an interventionalist. I don't do a lot of procedures, and really my goal is prevention. And in this field, we have a huge opportunity to prevent heart disease, prevent stroke, and prevent major comorbidities that go along with people being in the hospital and being sick. And even without medicines, if we can do a couple lifestyle changes, get people to lose a couple of pounds, exercise a little bit more, we can make them happier and healthier for a very long time. And that's something I really try to focus on and I try to push for my patients.